Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about a stiff knee after knee replacement surgery and what are some of the surgical options for when you have a unrelenting, stiff, tight knee after surgery. So before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery, rehab, recovery, and much more. So stiffness and tightness of the knee after surgery is extremely common, and especially early on, those early phases after surgery, the first few weeks, the first few months, definitely normal to have tightness, stiffness, and those sensations. And of course, early on in the rehab process, we're working on improving that range of motion, so getting as much extension or straightening as we can, as well as getting as much bend or flexion as we can. Now, unfortunately, for some folks, you're just not able to achieve the amount of range of motion, the amount of straightening, the amount of bending of the knee that you want, or just in general, the knee feels really stiff, really tight, really uncomfortable. Now, the first line of defense before we get into some of the surgical options is really going to be intensive physical therapy. So using those first 6 weeks, those first 12 weeks, probably sometimes more than that, to really work on that range of motion on your own with exercises, with the physical therapist, possibly using certain pieces of equipment or devices to help increase your range of motion, decrease that stiffness, decrease that tightness as much as you possibly can. But again, for some people, that may not be enough. So what are some of the surgical options? So the first thing is going to be a manipulation under anesthesia, or an MUA for short. And basically what this is you will go and have basically a surgical procedure where you'll be put under anesthesia and put under sedation. And while you're under sedation and the anesthesia, the surgeon is going to go in and they are going to manipulate, they're going to mobilize your knee joint. So they're going to bend it as much as they can, they're going to straighten as much as they can, and they're going to break up adhesions, break up the scar tissue, and increase and see what range of motion they can get out of the knee. Now, once you are done with this procedure, then this is going to be followed by intensive physical therapy. So getting in with physical therapy and then continuing to work on that range of motion, maintaining it, working on the bending, working on the straightening, and maintaining that for pretty intensive surgery for the few days to weeks after having this done. A lot of people, and in most cases, this is a relatively low risk procedure. There are risks in general just with surgery and going under anesthesia, and there is a small risk of fracture, which is of course increased if you have frailer bones, osteoporosis, osteopenia, things of that nature. But for most people, this is really a good way to get an extra 10, 15 degrees of range of motion in the knee, if not more, and decreasing that stiffness, decreasing that tightness. Now let's say that you've gone through the MUA, or maybe you aren't a candidate for an MUA, depending on how far out you are from surgery or where you are with your range of motion. The next step, surgically speaking, would be arthroscopic surgery. So going in with the scope and trying to break up and remove and debride the scar tissue and the adhesions. So this may be similar to what you might have as an arthroscopic surgery, just if you're before having a knee replacement, if you have arthritis in the knee, may be warranted. But this is, again, going in there with the arthroscopic procedure, trying to break up those adhesions, break up that scar tissue. Once again, this is going to be followed by some intensive physical therapy, trying to maintain that range of motion, trying to keep that range of motion that you're able to achieve after breaking up that scar tissue and those adhesions. So again, surgery and physical therapy are very interrelated with each other. Now again, the next thing, kind of the next step, is in rare circumstances there may be some issues with the prosthetic, with the knee replacement itself. This may be with the metal components, they may be too large or a poor fit. Nowadays that's less and less common just because of all the technology we have, the CT scans and all this to really get customized fits of the knee replacements, but it can still happen. Sometimes also the spacer or the plastic polyethylene component can be maybe too thick or not the right size, and they can also make some adjustments to that as well. Now the last line of defense, kind of the last option, if you're really having stiffness, really having tightness, really having issues with your knee replacement, would be a full revision knee replacement surgery. And again, this is really the last option because it's the most intensive surgery. It has the highest risk value involved. The rehab, the recovery is in many ways similar to your first or an initial knee replacement surgery, but there are definitely more risks of having some issues. You have to remove the prosthetic of the original replacement, and then oftentimes you have to make some changes, do some cutting, some shaving of the bone. So you have to have good bone stock, they say, a lot of bone available to do a revision knee replacement surgery. It is kind of a more skilled, more technical surgery, takes a little bit longer than a normal knee replacement. And so really, something we want to leave as the last resort. But for some people, having a revision knee replacement can be really beneficial. Really doing, having the knee replacement, having your physical therapy after for a number of weeks, a number of months to really, again, work on that range of motion, work on that strength, decrease that stiffness, decrease that scar tissue adhesions. And then a lot of folks are going to come out the other end happy that they did this with improvements. Now, this isn't always the case. Not everyone is going to be successful with these surgical options, so it's important to keep that in mind and have that discussion with your surgeon. What are, the risks? What are the benefits of doing these different options? How likely can I expect to see improvements? How significant will those improvements be? Really have that realistic discussion with your surgeon, and they're going to be able to lead you in the direction that is most appropriate and individualized for you. So I hope this gave you some good insight. If you have any questions or comments, please be sure to leave them below in the comments as I do my best to get back to you. Please be sure to hit that like button if you found this helpful to help spread this video, and I thank you very much for watching.